Assalamualaikum and a very pleasant morning. I bid to all of our visual audience in this Google Meet and our live stream viewers from IPG KBM YouTube channel. Welcome to our online forum entitled COVID-19 Vaccination, the next new normal. So I hope all of you will pay full attention to this forum. Before we proceed, I would like to introduce our panelists today. So our first panelist is Dr. Vaisanavi, the head of General Medical Department in Sungai Balai Selangor. How are you today, Doctor?
Yes, I'm fine.
Okay, so next is our second panelist, Professor Madhya Rabiatul Adawiyah, the Associate Professor from Faculty of Medicine in University Malaya. How are you doing this day, Prof?
Yeah, I'm okay.
Okay, thank you. And so before we proceed to our main ideas today, I would like to give a quick brief about vaccination and also COVID-19. So on 31st December of 2019, WHO was informed of cases of pneumonia of unknown cause in Wuhan City, China. A novel coronavirus was identified as the cause by China authorities on 7 January 2020 and was temporarily named 2019 nCoV. So on 30 January 2020, Dr. Tedros Adhanom, WHO Director General, declared the novel coronavirus outbreak as a public health emergency of international concern. So for your all information, on 25th January 2020, the three cases were detected on tracing and screening after communication from the Singapore Ministry of Health that 8 close contacts of a confirmed case of a Chinese nationality in Singapore had traveled into Johor, Malaysia. But thankfully, we already had begun our vaccination and immunization program, which take place on 24th February when our former Malaysian Prime Minister Tan Sri Muhyiddin Yassin had received the first dose of Pfizer BioNTech vaccine, kicking off the national COVID-19 immunization program. And so I would like to ask Dr. Vaisanavi, actually what is the definition of vaccination, or we can also call it as inoculation, and can you tell us the process to make the vaccine?
Yes, thank you, Katya. As we know, the world all has been affected by the current COVID-19 pandemic. This pandemic also the greatest communicable disease outbreak to have hit Malaysia. Since the World Health Organization (WHO) declared the COVID-19 outbreak a pandemic back in March 2020, the virus has claimed more than 2.5 million lives globally, with upwards of under 13 million cases being confirmed by laboratory tests. March 2021, the pandemic was impacted almost every corner of life, causing global economies to stall, changing the way we work and interact with our loved ones, and stretching healthcare system to the limit. COVID-19 vaccination is now offering a way to transition of this phase of pandemic. We almost heard everywhere about vaccination, but did we really know the actual definition of the vaccination? Well, vaccination is an act of introducing a vaccine into the body to produce a protection from a specific disease. And then now I'm going to share about the process to make vaccines. For many viral vaccines, this process begins with small amounts of a specific virus that can be grown in cells. Various cell types may be used that reproduce repeatedly. The first step is the generation of the antigen used to induce an immune response. This step includes the growth and harvesting of the pathogen. It depends on the platform. For viral vector vaccines, you take some of your harmless cool virus after you have added the spike protein DNA to it and grow it in a cell culture. Although the virus has been altered so it can reproduce in the body, it can still replicate in a specially designed cells in this cell culture. You will then have this bulking up of the virus over the course of a few days, anywhere from 4 liters of cell culture up to 20-30 liters. So the vaccine will be released when you can prove that it's the exact purity, sterility, and composition that you are claiming. So that's all from me.
Thank you, Doctor, for your great explanation and also a very beautiful slide there about the concept and process of producing our vaccines. And I somehow agree with you that we should not take this COVID-19 as a small matter. As we all know, actually COVID-19 pandemic is the greatest communicable disease outbreak to have hit Malaysia since the 1918 Spanish flu, which killed 34,000 people. As you all know, just a little bit information from our COVID Now portal, actually the mortality due to COVID-19 until 7 December 2021 had recorded over 30,000 cases, and it is quite a worry for all of us. But thanks to all Malaysians, to all of you, the viewers today, that are very supportive to still spread the awareness about how vital this vaccination program for our community. So let's move to our second panelist, Professor. As we all know, before this, we have specific vaccination program that had been used to prevent some disease like polio, BCG, HPV. So can you share with us about the previous vaccine and the good effects of it? And can you explain about how our COVID-19 vaccines are going on today?
Okay. Okay. Sure, why not? Okay, as we know, the first vaccine arrived in Malaysia on the 21st February 2021. There are three phases of the immunization program. First phase is from February to April 2020. Then 2021. It is also focused on seniors who are 16 years old and at risk groups, while the third phase is on May 2020 until February 2022. Okay, this phase is set for all groups, especially for those aged 18 and above. So from here, we can look at the benefits of being vaccinated. What is the best is when someone got the COVID-19 but had been vaccinated, it just takes a shorter time to recover than usual. As an example, there are some people who are told that COVID-19 needs a long time to recover, but he just needs 10 days and he is free from being a COVID-19 patient. Other than that, Tan Sri Dr. Jamilah Mahmud, who is public health advisor to the Yang Amat Berhormat Prime Minister and member of the Management Committee of the National Council of Women Organizations, NCWO, said that vaccination is the important thing when it benefits more than risiko. It improves when pregnant mothers took the vaccine and it carries antibodies to the baby when breastfeeding. For the next question about is the vaccine still working today, the answer is yes. It is because they focus on the secondary students. It aims to have all students vaccinated before school is fully open. At the same time, the third dose of vaccine will be given to the group in the second phase. As we know, before before, there were only two doses of vaccine, but it has been updated. So now has started giving the third dose of the vaccine. So that's all from me.
Thank you, Prof, for the explanation. It is actually so true that if you already got fully vaccinated, the chance to be affected by this disease is very low. And even though you was diagnosed with the COVID-19 malady, the symptoms might not bring any harm or dangerous effect for you. According to our current data, more than 90% of the new COVID-19 cases reported today are in category 1 and 2, in which patients only display mild symptoms or none at all. So that's why I need to remind all of you that being fully vaccinated is actually a great impact for all of our community. We get back to our first panelist. As we all know, when we are talking about pandemic, it means that situation has occurred around the world. So can a doctor explain to us the acceptance of vaccine across the world? Is it good or not actually?
Okay. So COVID-19 vaccination will help protect us from getting COVID-19. Willingness to get a COVID-19 vaccine was considerably higher in developing countries. 80% of respondents than in the United States, 65%, and Russia 30%, according to new research published July 16 in Nature Medicine. You may have some side effects, which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in a few days. Some people have no side effects. Serious side effects that could cause a long-term health problem are extremely unlikely following any vaccination, including COVID-19 vaccination. Vaccine monitoring has historically shown that side effects generally happen within 6 weeks of receiving a vaccine dose. For this reason, the FDA requires each of the authorized COVID-19 vaccines to be studied for at least 2 months after the final dose. The common side effects are likely on the arm where you got the shot. Sometimes they told that we might be a headache, muscle pain, tiredness, and so on. These side effects happen within a day or two of getting the vaccine. They are normal signs that your body is building protection and should go away within few days.
Okay, thank you, Doctor, for telling us a little bit about other countries' efforts in supporting this vaccination program. We can see actually even the veto power countries like United States and also United Kingdom really prioritize their citizen safety from this pandemic. Based on the United Kingdom data, nearly 50 million of citizens have received at least one shot vaccine there. Just to share with you guys, yesterday I had watched the EPL highlights with my brothers and I realized that some of the spectators didn't wear masks anymore as in Europe most of them had reached herd immunity earlier, but still we need to stick to SOP and regulations from Ministry of Health. Professor, can you try to explain to us actually what is the true benefit if we get fully vaccinated?
Okay, okay, so let's see if it's good to be vaccinated. Firstly, once we have been vaccinated, it can reduce the risk of getting COVID. This vaccination is the best method to ensure that the human body becomes stronger to prevent infectious disease. If a person has been infected with COVID, he will experience several phases of symptoms. Nevertheless, uh, there were also patients who did not experience any symptom, but when doing a COVID-19 test, he was found to be positive COVID-19. So here are some lists of symptoms of coronavirus disease. Most people consciously become infected when they get fever, cold, tiredness, and loss of taste or smell. Why? There are also less common symptoms which are some throat, headaches, aches, and pains, diarrhea, diarrhea, a rash of skin or discoloration of fingers or toes and red of irritated eyes. But the serious symptoms are very dangerous when someone has difficulty breathing or shortness of breath, loss of speech of mobility or confusion and chest pain. Patients who experience this serious symptom can die. These people may need a respirator to help them breathe properly. Next, does the COVID-19 have its levels? In fact, COVID-19 has different levels of disease. It is similarities with cancer stage, where stage first and second can be safe, while stage third, fourth, and fifth are dangerous stages. This is because the infection begins to hit the lungs. This will interfere with the human respiratory system. This is something that is very much feared by patients because at this stage, the patient will fall asleep. Most of these cases lead to due to the lungs not being able to function properly. This case is done for a specific purpose that brings interest to the public. That's all from me.
Okay, thank you, Prof, for the explanation. Yeah, actually, being fully vaccinated is really an advantage for you. But I need to remind all of you that being fully vaccinated doesn't mean you are guaranteed invulnerable or immune fully, but it just can at least reduce the outrageous symptoms that may lead to death. So we go back to our Dr. Vaishnavi. Can you tell us about the second benefits if we fully vaccinated?
Okay, so now I'm going to explain about the active herd immunity. So the idea of immunity as the solution to the COVID-19 pandemic has triggered heated debate. But what is herd immunity and how does it work? Herd immunity is the indirect protection from a contagious infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. This means that even people who aren't vaccinated or when the vaccine doesn't trigger immunity are protected because people around them who are infected person. Once herd immunity has been established for a while and the ability of the disease to spread is hindered, the disease can eventually be eliminated. In the US, smallpox and polio have both been stamped out because of vaccination. However, there are certain groups of people who cannot get vaccinated and are vulnerable to disease such as babies, pregnant women, and immune-compromised people, such as those receiving chemotherapy or organ transplant. So, a large percentage of the population will need to be immune against the disease through vaccination or need immunity will be achieved. It is not known when that will happen, but it will depend on how many people get vaccinated. Throughout this time period, until herd immunity is achieved, it is very important to continue to wear masks in public and social distance to slow the spread of COVID-19. On December 11, 2020, the US Food and Drug Administration (FDA) have proven the vaccine to be the safest, most cost-effective way to protect people from disease, so that our country's health minister plans to procure COVID-19 vaccine through people. That's all from me.
Thank you, doctor, for those advice that rather than vaccination, actually we need to always follow the SOPs that have been regulated by the country. We need to accept the reality that we ought to live in this norm continuously, like wearing masks, social distancing and online shopping, even though maybe the cases nowadays are decreasing day by day, but never ever take it easy because we have learned lots of lessons due to our ignorance. If you still remember in July 2020, Malaysia once recorded zero cases and a single digit case consistently with a very rigid SOP. At that time, we had been clarified as the most successful country in battling in COVID-19 disease. Unfortunately, after the government had loosened up some SOPs, there were a few citizens that went over the board until another wave of COVID-19 occurred in Malaysia. So guys, never lower your guard. So for our last question for today's session, I would like to ask Prof, actually what are the preventions that can be implemented rather than just getting vaccination?
Okay, actually, the best way to prevent from COVID-19 is to get vaccinated. But our government always advise us to do 3W, which is wash, wear, and warn, and also avoid 3C, which is crowded place, confined spaces, and close conversation. Okay, 3W is the must thing we should do. Firstly, what is meant by wash? Actually, we are advised to wash our hands frequently and use sanitizer before or after doing something. It is to keep our hands clean from germs. Secondly is wear. It refers to us always wearing masks when going out from home or going to public place. But there are exceptions to not wearing a mask when relaxing, exercising, and eating. All people are advised to open the mask when eating at a restaurant and put the mask in the right place, not on the chin. For the last W is one. Normally, people always shake hands when meeting each other, but now we are not encouraged to do so to prevent the spread of infectious disease through contact. So the practice of 3W needs to be practiced in our life. Then, why we should avoid 3C? It is dangerous. Okay, it is actually to remind us that such thing can expose us to COVID-19 disease. When we are in a crowded place, we are more exposed to crowds when we don't know if everyone is healthy or otherwise. It can affect health if there is one of them that has been infected. This can cause the case of COVID-19 infection to increase over time. Other than that, confined spaces can also cause the spread of infection. This can also cause the same thing to happen with crowded places. They cannot breathe fresh air. This makes them more susceptible to infection because there is no good ventilation. Okay, in addition, close conversation should be done at a distance of more than 1 meter. This is also because studies say that the spread of COVID-19 can can occur within a distance of 1 meter. The government has also introduced a SOP to remind everyone related to COVID-19 disease. Lastly, if you want to get vaccinated, you must install and register your information in the application MySejahtera. You must update your situation to make sure to make sure you get the vaccine quickly. Besides that, you also can register directly at the vaccination center near you. The staff will guide you when filling out of the vaccination form. That's all from me.
Okay, thank you for Prof for closing up our session with a very didactic information. I guess in Selangor they are having heavy rain in that time. Okay, so in the nutshell, I could conclude that COVID-19 shall not be something that we can joke about. Even in today's forum, we had discussed about the definition of immunization and its role in nationwide. Hence, I really hope those who still doesn't receive your jab, please get it as soon as possible at the nearest vaccination center. If you have any inquiries about it, you guys can contact the list of the medical officer numbers that we have distributed just now, or just go through my Sejahtera help desk or COVID Now portal. So remember that your choice may change your future. So that's all for today's forum. Thank you to all our panelists and also the viewers for your time today. So thank you.
Thank you.